Good morning, everyone. Today is Tuesday, and it's March 17th, 2020. The time is 10:05 a.m. This is a special meeting, and essentially it's come about because of the situation with the coronavirus. It is a special meeting with our Office of Emergency Management, and attending our commissioners, Duncan and Filios, in physical form, and joining us by phone is Commissioner Bill Brooks. Also joining us is Civil Prosecuting Attorney Jamila Holmes. And we have one item on the agenda, but we will open up, as we always do, for public comment, so I think you'll find that interesting as well. So do we have any changes to the agenda? Okay, and I do want to thank everybody for attending, especially Joe from Public Health. Panhandle Health, forgive me, which is Public Health, but that's okay.
Yeah.
Anyway, so the first item and the official item on the agenda is Kootenai County State of Emergency Declaration, Resolution, and a potential action item. As you probably know, on Sunday, with the help of our OEM and the Sheriff's Organization, my co-commissioners, we had a representative present from Coeur d'Alene PD as well, and other groups. I did sign on behalf of the board the emergency declaration, which activates the Emergency Operations Center and all the resources necessary to help us through this crisis. So what we're doing today is taking up the official resolution, which would require the approval of hopefully all three of us. So should we read it? Jamila, what would you recommend?
You can proceed how you see fit. So at this point, the chairman has made a declaration which gets the ball rolling for 7 days. If the board is so inclined, the chairman would entertain a motion and then a vote from the entire board on continuing this chairman-found disaster.
Beyond the 7 days?
Correct.
Okay. And incidentally, that was yesterday the recommendation of Chris Way from Emergency Medical Services. And so I guess I would entertain a motion, if the board is amenable, to extending the declaration beyond the 7-day period.
Sure, I move, excuse me, hold on. All right, I move that we sign resolution 2020-31 declaring the disaster emergency state for the county, which this further confirms chairman's, continues the resolution 202029, which was signed by Chairman Filios, declaring a disaster emergency on behalf of the county of March 15th, 2020.
I second the motion.
Bill Brooks,
Aye.
Commissioner Duncan,
Aye.
Chairman Filios.
Aye, and the motion is carried to extend the emergency declaration beyond the 7-day period. Thank you.
Bill, does staff have your permission to use your stamp?
Absolutely.
Okay.
Okay. Okay, so the resolution is signed by the two of us, and Commissioner Bill Brooks has authorized staff to stamp his signature, and so all three commissioners are in approval. Okay then, so we're going to move on to the public comment segment of our meeting. Who wishes to speak? Larry, introduce yourself, address, tell us a little bit your title.
Larry Spencer, 605 East 17th Post Falls. My role is
Do
just...
you want to stand up? Might be easier.
My role is as a private citizen in this, but I've been looking at the numbers on this for almost 2 months, since about January 20th. Something has caught my eye on this that I think needs to be addressed and understood a little bit more clearly. The first thing is that, after we looked at the numbers from China, we weren't able to gain a lot from them because they weren't adding up quite right. So a couple of weeks ago, we threw out the numbers from China and began looking at the numbers in the rest of the world. And we noticed a couple of interesting things. One of the countries who is best equipped to handle this seems to be South Korea. South Korea began researching this and preparing for this back in 2003. Right now, or as of yesterday, South Korea had almost the exact same number of reported deaths as we have here in America. But they have twice as many people that they have identified with the coronavirus or COVID-19. Yesterday we had 4,138, they had 8,236. The other interesting thing, even though our deaths are only, yesterday they had 75, we had 71, is that our recoveries yesterday was 56. Their recoveries was 1,137. So I looked at the numbers because my concern was that there's a perception that it's only affecting the old. And to a degree, that's true. But the premise that I was looking at is I believe that it's actually affecting everybody, but we're only testing the people with the most severe symptoms, which are generally the elderly. So we have this hidden population, primarily in the schools and in young people. So with that in mind, I looked at South Korea and said, well, they're testing everybody. They've tested 275,000 people. I mean, it's a dragnet testing operation there. So I decided to see if I could find their numbers to see if they're finding a bunch of people without serious illness. And they are. It's in the young. If you look at their age group on the second page of the handout, if you add up the numbers, the percent of that 8,320 that are held by people from 0 to 29 years old, you'll find that it's 34% of their total, and yet accounts for absolutely 0 of their deaths. So that's a third of it. It's roughly a third of their population age bracket. So what that tells us is that when you do full testing of people with symptoms or without symptoms, you find that it's evenly spread across every age group in society. If you look at the age group that they have on the bottom, this is on the updated one, 16 to 18-year-olds, they have 128 cases. But what they're doing in their testing is they're identifying people that could be spreading it without symptoms. And since no people under the age of 30 have died, and only actually in South Korea, and only actually 2 people under the age of 50 have died, out of thousands of cases, that would be likely that those did not have the same testing criteria as symptoms that we use in the United States to do our testing. So essentially, those are the hidden spreaders. We don't know how much they spread, but we do know that they're likely contagious because they did or do have it. What it also what it also shows up in is it shows up in that 1,100 recoveries where we have only 56. Is because the mild cases and those that never show symptoms, those show up as cured. The concern with this is essentially the schools. I'm concerned about the schools because today I found an article that's on page 3. It says this is in France, more than 50% of most severe coronavirus patients in France are underage. Now, France hasn't done extensive testing, but they're finding that they do have cases of it there in the underage population. School District 271, I'm concerned about because they're planning to hold School Plus with groups of 200 children starting tomorrow. The perception, again, seems to be if we don't have testing in America that shows that children have it, then it must be fine to gather them together. I realize that, then one other thing, today, I was asked by somebody yesterday, if there's any other countries that show these same type of high test results, that they're testing extensively.
It's okay, hold on.
And what I found when I scanned through the list of all the countries, I looked for a large number of tested or a fairly large number of individuals without many deaths. And what I found was the UAE. So I Googled the UAE because they have 98 cases, 0 deaths, and 26 recoveries. But the fact that they haven't had any deaths would indicate that they started testing, and they're testing extensively. When I Googled them, I found that's the case. They hold the world record for testing.
UAE.
The UAE. They have tested 13,000 persons per million population. So they've tested a lot, and the result is they found it, but they haven't found the cases that have so far resulted in a single death. So it's out there, and it's out there in the population that doesn't know or feel like they have it. So the concern that I have is specifically the schools. I'm sure that the Panhandle Health representative would probably concur, although I'm not trying to speak for him, that schools are very much transfer stations, as it were, for colds, flus, viruses. It may not strike the children in the same way that it strikes the elderly, but they are the places that there's a lot of transfer of disease. Just because children haven't learned the same hygiene habits, distancing, things like that that the rest of us have. Trying to think of what else. So, again, I think that we've got, based on the numbers of South Korea, we've probably got at least twice the number of people that we know of that have it, and possibly up to 3 times the number. The concern is if we don't do something about that early, it's harder to do it, as China found out about it later. I would say that there's kind of 3 types of containment that can be done, or not containment, but to reduce the spread. There's 3 steps that can really be taken. The first is social distancing, which we're already engaging in, limiting, the travel, limiting groups, etc. The second is what you find in, things like school closures. And the third is what we have had in China, and what they now, my understanding is they have in San Francisco, which is basically shut down the economy and shelter in place now. Interestingly, South Korea never had to take those steps. People are still going to work in South Korea. They're wearing masks, but they're still going to work, and basically life is proceeding as normal because they've identified the people that have it, so they know who needs to be isolated at home and who doesn't. I realize that shutting schools down is very inconvenient, especially for the parents. But there's something that is, I think as a society we can agree, is significantly more inconvenient, and that's planning funerals. So that's the choice that the rest of the world has learned they're going to make. And I'd like to say that we can learn from the rest of the world, and just because it's on our doorstep and not yet in our living room doesn't mean that we should pretend it's not coming in. It's probably already here. I heard that there's, in conversation before, that there's quite a backlog of tests that haven't been processed yet. So we don't know if it's here, and we simply haven't gotten the test results. So I would encourage the county to do whatever they can to facilitate testing, to push the envelopes of who is allowed to be tested, and to look at especially the schools and making sure that we're not bringing together groups of kids that can then spread it unknowingly to their families and their relatives.
Okay. So is that your recommendation?
At this point, it would be. It's certainly not my decision to make, but based on what I'm looking at and the way this has progressed, I've watched it progress now for 2 months around the world. There's a very interesting video that was put up by the World Health Organization, and essentially it was shot in France. A bunch of people were asked to make a video to themselves in 10 days future. In other words, going back and telling themselves, hey, here's a message, do this and take this seriously. And it's quite chilling because they have the same attitude that a lot of Americans have, and in the course of just 10 days, their entire lives have been turned on end. And so thinking that what happened in China is across the ocean, and what happened in Italy is across a different ocean, doesn't change that when it hits here, if we're not ready for it, it's going to be the same. so.
Jamila Holmes,
Go ahead.
Deputy Prosecutor for the record, just really quickly, is this more informational because concerns about medical testing and school attendance would be well outside of the scope of what the commissioners can handle?
I think that the medical testing is outside of what the commissioners can handle, although they can simply, they're in a position where they can advocate for that. With regard to the schools, I'm not entirely sure what powers they have over gatherings, but I think that they do have that within their purview, although that's something that.
You believe that the Board of County Commissioners
I
has
believe-
oversight
I
of?
don't know that they do.
Oh.
But I think that they may, based on some of the, once a declared state of emergency exists, can they order closures? In Washington, for example, today, yesterday, the governor of Washington ordered, and this is St. Patrick's Day, everybody, so happy St. Patrick's Day. But even on St. Patrick's Day, this is the first day that restaurants are closed in Washington. So if they can close restaurants with an executive order from the governor under a declared state of emergency and limit gatherings of a certain number of people, I'm not a legal expert on that, but I would suspect that the board probably has the authority to order
It's my position that the board doesn't. The governor's powers in a disaster declaration situation are very different from what the Board of County Commissioners is doing. But I value your input and, you know, presenting this information not just to the people here today, but who are, I guess, joining remotely. I didn't want you to think that following this meeting, the board would be able to
No,
go out and gather tests and close schools.
no, I don't think that, but I do think that they're in a position where when they issue a resolution, advisement, whatever, a lot of other people are going to be paying attention to what they're saying. So, it's more information, yes.
Mr. Spencer, just for those of us who don't have kids, you said that School Plus was going to be in session and
Mike?
gathering groups of 200 kids. What is School Plus?
My kids are not in that school. It's a program in, I believe, District 271, which is Coeur d'Alene. I think that it's a after-school program. So I'd have to check on that. That was just information that was given to me by an employee of the school district.
Joe, thoughts?
Interesting analysis. I think we all understand that there's a lot of information. I'm not certain of the validity of any of the information that's out there, you know, across the scope of the internet, for instance. It sounds like you've gone to some significant steps to find comparisons in other countries. I would just caution us that comparisons in other countries don't take into consideration hundreds, if not thousands, of variables in that data. I think it's important for us to stick with the recommendations that we have currently from the CDC. And, you know, I was encouraged when I walked in here to see that the county commissioners have put those provisions in place. We're all kind of sitting separate from each other. We're doing those things that we think are prudent. And we've certainly consulted with all of the districts up to this point. We continue to do that. We're in constant communication with child care facilities. We're sending our teams out to make sure that the processes and procedures that we recommended are being followed in those child care facilities, as well as the other areas. We've had, interestingly, with regard to bars and restaurants, we've had inquiries from the restaurant owners and operators. They've called us proactively and said, what steps can we take? We've advised them on that. We are not in a situation where it's been ordered, but it's certainly being recommended that they shift to a format that allows people to either drive through, or if it's not a drive-through operation, that they can pick up. And we're pleased to see that many of those restaurants are, you know, ensuring that the bag is sealed, that it's placed in a place where the customer can pick it up. It's paid for electronically, separately, and they're on their way, or it's delivered in a way that there isn't necessarily contact. So there's a lot of folks that are just voluntarily stepping up and doing that. And I want to applaud that. I think that's very helpful.
Any other thoughts, Steve, please?
Just a question, since we have the experts here, from a county perspective in the buildings here. I'm the Kootenai County Treasurer. We have people coming to the desk each and every day. Our assessor, similar situations. There are a number of areas within the county. I would like your advice. Are there any protocols that we should be implementing as it relates to that beyond what you mentioned with what we've already posted with the invitations?
We also have counters, in our facilities, and we have the public still coming in for a variety of services. What we've asked our janitorial crews to do is more deep cleaning, and also like things that we wouldn't normally think about, but disinfecting the handrails on chairs. Whereas before that may not have been something. And I don't mean just wiping them with a cloth. I mean actually using an approved EPA disinfectant and then cleaning that. Spraying surfaces thoroughly. We do that throughout the day as well. On the countertops, we give our employees materials so that they can keep the countertops clean. We have hand sanitizer at a variety of stations. We have masks behind the counter, a surgical mask, if you will, behind the counter for anybody who appears to be symptomatic. And we encourage them, that's more of a clinical environment. We're encouraging them, those prudent steps that are already out there on the CDC website and on the state website.
But you have not gotten to the point of restricting access by the public to the building itself?
No.
Nor would you recommend that to be
No.
counted?
However, if somebody thinks they're symptomatic of this particular virus, or even any virus, we're asking them to remain in their vehicle until, their appointment time, and then they can come in and be properly seen and triaged, for instance. That's a procedure that's being used at healthcare facilities throughout the country right now. I want to mention that people who are going in for healthcare, that's a very different
Right.
population or subset of the population than the rest of us doing things. But I think we're all probably, starting to be more aware of where we put our hands and what we do. I keep a little bit of sanitizer in my vehicle. I keep some, handy, and I have it in my office. We're sitting further apart. And, I had a
But
meeting
at this
this
point,
morning.
just to make sure I understand, you are not recommending that the buildings that are open for the county?
Not at this point.
Okay.
Not at this point.
All right. And you would notify us?
We
if
will
that-
notify all of our partners, certainly specifically through the EOC, and not just in Kootenai County, but in the other 4 counties that we serve. We will do it in real time. So,
And I also talk to Laura Whalen frequently.
absolutely.
I think we're on the phone 4 times yesterday, so I'll try not to
I
bother
know
too
that,
much.
that we're emailing and,
Yeah.
and I mean, it is, I think, Mr. Spencer, I applaud you for getting up and making the comments that you did. I think awareness is one of the greatest things that we can do now is to make sure people understand, look, this is not necessarily what we thought it was 3 or 4 weeks ago or a month ago. And we don't know where and how. I was just listening to the president driving in, and he was talking about how there may be clusters in one place and then not in another, and yet populations seem to be the same size of communities, and yet here it seems to be more prevalent and here it isn't, and yet the testing numbers are the same. There are anomalies that people far smarter than me are certainly applying themselves to, and I think that's important.
Sandy, do you have any comments?
One of my comments is that I applaud all the people in our community that were prepared prior to this, and I applaud the ones that are getting prepared now. What I would like to say to the public is to not hoard. I was at the grocery store yesterday and a little elderly lady came up to me and asked about toilet paper, and she said she can't find any. So what I'm talking about, I mean, there's no milk, there's no whatever, and there always has been. So I think it's important we need to be looking out for our neighbors and checking in on them and making sure that they have what they need. And again, take what you might need, but don't think you have to stock up for 6 months.
Right.
You're really impacting those people that need supplies and that cannot get them, and they're just normal things every day. Not everybody can go out and spend a ton of money for things.
For things like that, yeah.
Yes.
Steve?
Just a clarifying question. Who's controlling the decisions that you make? Are you relying on the governor or the CDC, or are you making these decisions independently?
No, I think collaboration and cooperation is at some of the highest. This is about my 40th year in government, and I can say that collaboration and cooperation is certainly at a high functioning level. I mean,
I understand that, but you're not gonna make a decision contrary to what the governor says.
No, we're in constant contact with the Idaho Department of Health and Welfare.
Okay.
We consult with them on any of these things. The health district directors, each of the 7 of them, are daily conferencing to ensure that their messages and their understanding of the problem as it relates to Idaho is being informed in the group, and then with IDHW in the governor's office. We're in contact, and I'm the liaison to the county EOC. I will be going to their daily briefs, and I'm available to Sandy. We talk frequently throughout the day. So yes, everything's, Panhandle Health District is not going to make an independent decision uninformed and without coordination and consultation with the appropriate entities, and that includes the board here.
I think where Mr. Spencer's coming from, though, if I understand it correctly, correct me if I'm wrong, is that I think his premise is we're simply not testing enough. Now, it's interesting, this morning I just happened to notice on the business news that in Dallas, they have basically, if you want to call them, drive-through facilities. And what they do is they test initially for strep and flu. If those come out negative, then they test for the virus. Now, I don't know how many people they're processing, I don't know, these are obviously interim facilities, they're not formal drive-throughs, they may be parking lots of hospitals, I'm not sure. But am I correct? Your premise is we're simply not testing enough.
I think that testing is going to be the only way that we're able to get in front of it based on the countries that seem to have, if you look at the numbers of South Korea, for example, with 8,000 cases, their numbers are not rising. They've been able to, even though they got hit early, it didn't take off in South Korea because they identified people, even those that didn't have symptoms, and they were able to isolate. So yes, I think testing is probably the only way that we're going to be able to not be at the mercy of the natural process of running through the society.
How do we request more testing?
There you go.
Testing is probably the single most challenging component here.
But
Let me say what I mean about that.
go right ahead.
The dynamic is, I mean, it is a dynamic. It's constantly changing from day to day. In terms of the capacity, the different kinds of tests, the availability, and all of that is spreading throughout, our society in a manner, both public and private, that are getting testing capability out there. Tests are still required to be ordered by a healthcare provider, by your primary care provider, a physician, a PA, or an NP. Even at a drive-through, you're still going to have to consult a medical professional to get the test. That, according to the Vice President this morning, that process is going to be actually placed on a computer screen in your home at some time in the very near future, where there'll be an algorithm you'll go through, put it in, doctors will review it, or healthcare professionals will review it and decide and tell you where and when you can get tested in your area. And apparently, Google and some of the other companies are participating.
But the thing that's interesting here is that I don't know how South Korea is conducting these tests, whether they have kits or they're using more, I don't want to say primitive, but more conventional methods. Why aren't we?
Well, I don't know that we aren't. I mean, we're presuming that we aren't doing a lot, and I think we are.
And I don't mean, I'm sorry, I don't mean to, I'm
Yeah, but
trying to put you on the spot. I
testing,
mean
for instance,
collectively, the US.
The Idaho Bureau of Laboratories is down in Boise. Test samples that are taken in North Idaho go by FedEx or by fast courier
And they're testing.
to their testing facility. They test twice a day. Okay, testing is not as easy as, taking a swab, and
Sure.
and it's not like, watching a TV program where color changes and everything's revealed. There's a lot of process involved. It takes time. That information is then relayed back to the provider, okay, and because it's reportable back to the health districts as well. So then we find out whether there's a positive or not. Then there are processes and procedures in place for that patient. What do we need to do for them? And what does that mean? So each and every one of those things is being done. Kootenai Health, for instance, has set up a testing facility that's separate from the hospital, separate from the ED. You get an order, you go over to that facility, you get tested, and then those tests are rushed to the laboratory, and they're looking at the capacity of the laboratory and other laboratories to be able to get those results back in a timely manner. So there are a lot of folks focused on the whole testing process and how we do it. It's not like two folks in a room somewhere in Georgia making all the decisions about testing. And then, there are literally thousands of people working on this right now.
So for a person to be tested, they should be symptomatic?
The current testing protocols, and I say current, based on the one I looked at yesterday afternoon, it may have changed this morning, okay, take you through some symptoms, essentially a fever, a cough, and some shortness of breath. Those are symptoms of many other respiratory problems as well. But those three take you to whether you've traveled, whether you've been in contact with a case that's confirmed.
Okay.
And by contact, I don't mean you were in the same building. I mean, you were sitting next to them.
So
on an
if somebody meets one or more of those criteria, what is the action that the individual takes? Do they call Kootenai Health? Do they
We
call
have a matrix that tells us where they're at, okay? Whether they're high risk, medium risk. We have a call center. And
Okay.
I have that information here for you, and I even brought our, one of the
Go right
flyers.
ahead.
At the call center, for instance, if they call in, we're gonna walk them through that matrix, okay? And we're going to tell them, based on the information you gave us, your no risk, low risk, medium risk, or high risk, okay? If you're in the medium or high risk, we are turning that information over to our epidemiology folks, who then contact them, get more information in near real time, so within a few minutes of that call coming in, we have a referral sheet. Our epi team is then contacting this person and saying, okay, you said that you and we walk them through just to make sure that that's all, and then we can refer them back to their healthcare provider with the understanding that they've already talked to our staff, and now, they're in a situation where their healthcare provider can then make that determination as to whether or not they should get a test. Okay, but it's still, there still has to be what I'll call a medical order for the test.
Oh,
So I think that's part of the issue that Mr. Spencer brings up,
Right.
is we're having a whole population who's going around being carriers, and they're not being tested because they're not symptomatic.
There
And
you
so
go.
that's how this thing can, shoot skyward. But if, in South Korea's point, if they've identified all those ones who are carriers, they're taken out, everybody else still functions. But here in America, if we're not testing asymptomatic people, then we just have this situation where, you know, we're not gonna know until people are sick.
Dena, did you want to say something?
I just wanted to segue into some direction that the auditor's office would need. I don't know where the board is at as far as putting together maybe some policy guidance. For example, for payroll, we have payroll here. If a person is exposed to somebody who's sick, who we know is sick, or if an employee becomes sick, is the county going to call that administrative leave? And if so, according to our representative at EOC today, FEMA will pay and reimburse us for wages lost for people who are sick. So, we would want to make sure that if a person, if the county is gonna take the stance that, you know, if we want somebody to stay home and isolate, would we pay them administrative leave? And then would the auditor's office, would you want the auditor's office to track that so that we could apply for reimbursement when the time comes? Because we'll wanna make sure that we're capturing that information as people start, you know, going home if they're not working at home, or if they're, you know, if they're sick at home.
I'm sorry to interrupt. I
No,
know
go right
that this
ahead.
is shockingly inefficient, and I think the question is well taken, but it's beyond
Our
what we've
public
noticed
discussion.
here
Yeah,
for this hearing.
and I think
Yeah.
the simple answer too is we'll probably take it up at the EO meeting tomorrow morning.
Okay, so the auditor's office kind of has a list of things, like from a policy perspective, how the county is
Yeah.
going to handle this, because as this kind of unfolds, we wanna make sure we have a plan, at least from the auditor's standpoint,
Yeah, we
for
can, when we,
taking
Could you
money,
circulate
paying
that to
bills.
the 9 electeds?
Yes, paying taking money, paying bills, like the treasurer touched on, how, you know, what is considered essential services and how are those defined, and how do we maintain essential services, you know, and that we have a coherent strategy,
Yep,
so
yep.
I'll send that list.
okay, good,
Okay,
thanks. Sandy, did you want to say something?
Well, it was regarding that, so I
Okay,
that
so,
can be taken
okay.
care of. Except for, another thing I wanna say is, and I'm not the expert, this is all new to all of us. We definitely are looking to our health district, this is what they do. They too are looking at Idaho Department of Health and Welfare, who is looking at
At
the CDC.
CDC, right.
And when you say to test people that are not symptomatic, first of all, we're trying to keep up with all the tests that we're doing right now. There's a backload for.
Backlog.
Yeah.
Yeah, a backlog of getting that information. If you wanna triple that and whatever, we're still gonna be behind the 8 ball.
Sure.
So I know that the CDC is making a call. They have those experts there, and they're putting this information together, and it's being handed down to the states, of which gets handed down to our local health districts.
And I think you make, go ahead, Larry. You wanted to say something?
You know, I just had a question, actually, it was just touched on, or alluded to there as well. But when I came in before the meeting started, the gentleman from Panhandle Health had.
Joe.
Joe had mentioned, kind of a testing backlog of some sort. So my question, I guess, is how many tests have been taken, and how many days backlog are we for testing? for the county?
I don't wanna refer to it as a backlog, because I don't know that that's an appropriate description. There are a lot of tests in the queue. The queue is the process that's used to do the testing. Again, back to my earlier comment, one of the things that the president and the team at the federal level are doing is trying to build a huge capacity to have more testing facilities and capability. Because what we're talking about is several things. One is, do you have the laboratory capacity to be able to throughput the tests in a reasonable amount of time? Because if you test everybody, but it takes 15 days to get a result back, you're still at the same result that you're talking about, so.
How many days is it back, though? I mean, right now-
It is tested, and the test results are given to us twice a day, in the late morning and in the late afternoon. Okay, so there's 2 testing periods.
Your question specifically was turnaround?
Right, if somebody got tested
Yeah.
today, based on how long it's taking to come back, if somebody was tested today, when would that
We
anticipate?
could, if they were tested today and the lab receives the results today, we could conceivably receive a result tomorrow, sometime midday or tomorrow evening, okay? Depending on when the lab got the result and when they processed it.
So that's the actual right now, there's not hundreds of tests that they're sitting on, waiting to try to get them to test.
I can't answer
And this
that
is in
they're
Boise?
sitting on anything.
Okay, so let me-
They're getting tests, they're
Yeah.
coming in and they're.
Let me try to wrap this up. Okay, I think where you're coming from is, and I'm not gonna put words in your mouth, but ideally is you would like to see a resolution from the county commissioners that calls for increased testing, that finds its way to the governor, who, if he feels it's a credible resolution, so to speak, and agrees with it, forwards it up to the federal level, to CDC, to the president. So we're taking the lead and saying, for goodness sakes, you need to increase the testing. Where I see that is, I don't think it's a bad idea, but again, when you get down to the, and I don't know that any of us knows how South Korea is identifying, how did they come up with the 275,000? Were they symptomatic, were they asymptomatic? I don't know. So the thing is, if you can't identify the universe that has to be tested, how do you increase the testing? Well, right now, the universe seems to be those people that are symptomatic. You see where I'm coming from? If we were to agree to produce a resolution, that question is naturally gonna come up. So the governor picks up the phone, calls one of us and says, okay, who do you want me to test? What am I gonna tell him? Well, I don't know, I want you to pick out 35 people at random, test them. I don't know, and by the way, none of us here are experts. What's the answer? I don't know. I think the concept is a good one, that we need to increase the testing. But if you don't know what the criteria is, how do you increase the testing? In other words, you'd have to go beyond the symptomatic.
Yes.
I don't know the answer to that. I don't know that any of us does. Now we're getting into people who are experts in, epidemiologists, right? Anybody have any thoughts?
Well, just that you could take populations, you could do, one from each
Cross-section.
grade level
Yeah.
in schools. You could start picking people out, but I just don't see the realistic, if we don't have a test that is precise and requires low personnel and, low wait time.
What-
Like the drive-through, swab, and it's like, oh, look, it turned, here we go. Then,
No,
we'll,
I'm sorry. Bill, you have any thoughts?
Yeah, I think, having a background as a hospital administrator, a lot of this work, a lot of the random thoughts here are those that normally would be in the area of epidemiology. And I don't know that we have anybody who's trained in medicine, let alone epidemiology, that are qualified to make these kind of discernments on county staff, or even in the public that are at this meeting.
Well-
I appreciate Mr. Spencer's comments, but I would like to know what his education level is, and in what issues.
Yeah, but is that really relevant at this point? I mean, I think he's using some stats that I think are,
When people are making recommendations, I think we have a right to know.
I think it was more a public comment.
yeah, it's more of a
Yeah.
public comment. What I would say is this, if the board agrees, and I don't know that we have to make this decision today, but you might wanna ponder this, we can produce a resolution that calls for increased testing and leave the decision as to how that's done to the experts. That's if we are able to conclude that in fact we do need more testing, and then figure out what happens from there. Now, if, at that point, it would potentially go to the governor, he might look at it and say, yeah, I hear you, but I'm satisfied with current efforts. Beyond that, I don't know that we can do, what we can do, because we're not the experts. Somebody else would have to figure out the criteria for increasing the testing, if in fact the powers that be agree that that even has to be done. Any thoughts?
I think you need to have a reason for a resolution, not just a feeling.
Leslie?
I think we can just take it under advisement for now.
Okay. And we can take it up again. That doesn't mean a month from now. We can revisit it either later this week or next week, but
Monday.
anyway. Or, I'm sorry?
Monday.
Or Monday during status update. Good point. Any other comments? Thank you, Larry. Appreciate it. Thank you, everyone. 10:50, meeting adjourned. Thank you, Joe. Thank you,
I'll
Jamila.
call you back in 10 minutes,
Thank you,
Bill.
Sandy and Tiffany.
Okay, thank
I need to talk to you
Yep,
about.
you can go ahead.
Did you ask some more questions?